If people aren't sleeping well, it's very hard to get the body to heal itself. Without good sleep, it's very hard to get someone who's anxious to be less anxious.
Welcome to the Learnskin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, how are things going?
You know, I'm doing good. I'm feeling good. I feel good energy through my body. It's not so common for some of our patients, though. You know, a lot of people say that at least half of the people coming to dermatology also have psychological and psychiatric issues. And that interesting connection between the skin and the brain is what I think we want to explore today.
Yeah, you know, in fact, in our private practice, we actually did a study with a survey and looked at how often people are struggling with things like anxiety or depression or some mental health issue that goes along with whatever they're struggling with on their skin. And it was almost close to 65 to 70%. So there's no question. But guess what, Hadar? You and I don't have to do this alone. We're going to have a guest that's going to be an expert in this area.
Thank goodness.
Exactly. So we have Dr. Peter Bongiorno, and he is a naturopathic doctor, and he is passionate about changing how mental health is practiced by changing the psychiatric model to one that considers the whole person, go figure, right? And doesn't run to drugs when other natural remedies are available. So he received his medical degree at Bastyr University and has been doing research in mental health at the National Institutes of Health. And he has a thriving New York clinic and authored numerous books. So it sounds like this is the kind of person that we need to help us figure this out. Peter, welcome to the podcast.
Thank you, gentlemen. It's a pleasure to be here.
Welcome, Peter. It's so great to have you here. And I would like to start by maybe figuring out some of the basics, you know, because at least in my mind, I have a clear idea of what it is to go to a Western psychologist or psychiatrist. How is that different when it comes to naturopathic medicine? Where is it different and where is it the same?
Sure. Well, you know, I think the similarities are that our first interest is in the safety of the patient, you know, and towards that goal, I think naturopathic medicine is a bit different in the sense that we like to think about a lot of different ways to help the person, not just by giving symptom relief. In other words, when you see a psychiatrist, you'll probably get a medication when you have mood issues. And that can certainly help with symptoms, but it's not fixing the underlying issue. When you see a psychotherapist, I think that helps the underlying issue in terms of the thoughts. When you see a naturopathic doctor, especially someone like me who specializes in mental health, my job is to try to understand what's going on with the physiology that's really promoting the changes in mood, that's creating the imbalances in mood, and figure out how to use the most natural things possible to heal and rebalance those issues. So as a naturopathic doctor, I'm not against drugs, especially in urgent care situations. And if someone is in an unsafe situation and they really don't have anyone taking care of them and watching them. But what I recognize, and this isn't just me, but for example, the Journal of the American Medical Association a couple of years ago came out with a study suggesting that for depression, the drugs don't really work much better than a placebo in mild to moderate cases, which is the vast majority of the prescriptions for depression. So, you know, I think what it tells us is that there's so much more that we can be doing for patients with mood disorders. And it's really about looking for the underlying issues.
So, Peter, this is a really interesting point because I'd like to learn a little bit more about what are the questions that you might be asking that perhaps, say, a psychiatrist might not be asking, or what are the underlying pathophysiological mechanisms that you might be cueing into that perhaps the allopathic model doesn't cue into? And just to preface that, I'll say, you know, the allopathic model is also trying to look for underlying biochemical causes, but I think we focus so much on single target, single molecule that we miss this holistic person.
Yeah, I think that's true. And, you know, I mean, there's nothing wrong with looking at neurotransmitters, But I guess my question is, why are the neurotransmitters out of balance? So if you take an SSRI, a serotonin reuptake inhibitor, to help raise serotonin, and that does help, for someone with anxiety or for someone with depression, my question is, well, what is the reason that serotonin dropped to begin with? So yes, we can give a drug and raise it, but why not look at all the other reasons that are responsible for why serotonin can drop? For example, hormones can play a strong role in serotonin. In women, when estrogen is really low, that could change the production of serotonin. It can also change how receptors that are supposed to bind to serotonin are good at binding to them. And that's just one of many examples of things we can look at. Inflammation is another one. When inflammation is very present in a person, serotonin levels will drop as well. Nutrient deficiencies, not getting enough amino acids, especially something called tryptophan, can also drop serotonin. So there are many reasons why that level of serotonin can go down. And I think not just looking at giving a drug to raise serotonin, but actually looking at the underlying reasons why it's low and fixing those.
And you bring up a very interesting point about the connection between hormones and the central nervous system in general. I wonder if you can talk a bit about that. I know some of the research you did back in the days in NIH had to do a lot with a neuroendocrine connection. Maybe you can give us in a few sentences some introduction to that connection, because I think that's the next step to understanding the connection between the brain and the skin.
Yeah. So what happens, when we're stressed out, usually there's a thought that's going on there. Our human brains have this great outer cortex, where a lot of thinking goes on. And that sends signals to the middle of our brain where the fear centers are and the emotion centers are. And that area is called the hypothalamus. And when we send signals of fear to that middle center of our brain, that sends signals throughout our body to respond, and usually what's called a fight or flight response. So in other words, if there's a bear coming after you, you look at that bear and think, oh my God, there's a bear coming after me, it's going to kill me. It sends those signals to the middle of the brain, and then the middle of the brain sends out more hormones and stress signals to the other glands in the rest of our body to produce stress hormones, to vasodilate, open our blood vessels, to get our lungs ready to breathe more oxygen, to get us to run, as fast as we can. And at the same time, it also shuts down parts of the body that we don't need, especially our digestion, especially our reproductive system. Parts of the body that when you're running from a bear, you're not going to sit and eat, and you're not going to think about being amorous, because you're running from a bear to save your life. So some areas get heightened so we can fight or run, and a number of areas get shut down so we can fight and run.
That makes sense, totally. And I got to say that when I see a bear, I usually just call Raja. He takes care of things. I don't mess around with the bear. Okay.
It's good to have him.
My rule of thumb is to run faster by one step compared to the guy next to me. That's all.
You just have to have that one extra step.
Need.
No, but Peter, that makes total sense. You really put it really nicely how that all these thoughts, all these deep fears that we have, everything is actually expressed physiologically in our body. And, one of the best organs to sense all these hormones that are kind of roaming about and looking for receptors and looking for cells to affect is the skin. Both the hair follicle is very active and other cells, glands, are all very active in the skin responding to hormones. So maybe it's a good time to switch a little bit and talk about that connection directly, because I know one of the areas that you're interested is in the connection of skin health and how the stress in the body can affect that. Maybe you can tell us your approach to this when you see patients or when you think about it in general.
Sure. Well, there's definitely a very strong connection. There's actually a phrase coined called psychodermatology. And I don't know how long ago that was coined, but it makes a lot of sense. And that phrase really...
I think it started when the first dermatologist saw a bear.
Yeah, that makes sense. And they started getting hives all over their body. And
yeah, there you go.
It's really a word that just describes the interaction of the mind and the skin. There's this bidirectional relationship, right? The skin receives stimuli from the outside world, and those signals get sent to our nervous system. and then the nervous system, when we feel stressed out or when we feel a certain way, signals get sent back to the skin, and vice versa, especially when we're stressed out. And this is shown in the literature that there's a really strong relationship between stress and the manifestations of our skin, things like atopic dermatitis, which is when people kind of have allergies and eczema and itchiness and discomfort in the skin, or with acne, rosacea, there's a strong relationship with stress. Psoriasis, I can't tell you how many patients I've seen with psoriasis, and so often you get the same kind of story that the psoriasis came out after a very stressful event. The same thing with eczema and certainly with hives. And hives are interesting to me because, I'm also very interested in histamine levels. When people have a lot of histamine in their body, that can also contribute to a lot of skin issues, especially hives. And histamine itself is a neurotransmitter that can also participate in why people are very stressed out.
Peter, one of the things that you talked about and touched upon is stress. And by the way, all of your examples are very clinically apparent when we're seeing patients. Say even with itching. Itching goes crazy with stress. And then with stress, you don't get enough sleep. And then that drives another positive feedback loop. And we see this just driven over and over again. Now, when you talk about stress, I'm very curious, how do you assess stress? And what does stress mean? Is it just one thing, or are there nuances in there and different kinds of stress that you might
stress
key into?
is really, the environment and how it affects us. I guess what I'm interested in is not so much stress, but basically a person's resilience and how they respond to it. Because you can have someone, in the middle of a war zone, and they could be very calm and relaxed, and it doesn't really affect their physiology at all. And then you can have someone in the most benign situation. They could be on the beach in the most beautiful place in the world and being well treated, and they can be a wreck. So yeah, stress certainly plays a role. And certainly if we're under long-term stress, I have some patients who are primary caregivers for sick family members, patients who are working all the time and they come home and they have to take care of the kids. And then once kids go to bed, they still got to get the laundry done and clean up and try to get some sleep. So they only get a couple hours and they have to do it again the same. So for anyone who has enough stress, after a while, there's only so much you can take and it starts to change your stress system. I always like to ask my patients, certainly, what are the stressors that they're under? And then secondly, I like to find out more about their sense of resilience and how it's affecting them.
I love the fact that you're using the word resilience because it's something that we probably don't talk about enough in Western models. I know in Ayurveda and in traditional Chinese, there's this concept of resilience, whether it's somewhere embedded in Qi, or in Ayurveda, it's embedded in this concept of Ojas. It's your ability to be resilient. So this is very interesting. So, and maybe it's a good segue to talk about how do you address these issues when people come in? We talked about how the Western model really does look towards medications, but I would love to learn more about what are some of your approaches?
Well, in the books I've written a couple of books, and the first chapter of every book is about sleep. Right? Because if people aren't sleeping well, it's very hard to get the body to heal itself. So, sleep is when you detoxify, is when you de-inflame, when you clean stuff out. It's when the mitochondria, which are the energy packs of our body, fix themselves. So sleep is really vital to fix anything. And I know for mood issues, it's critical. Without good sleep, it's very hard to get someone who's anxious to be less anxious. It's important to balance blood sugar. So the two things, I kind of have like an informal rule with patients. If I hear a patient isn't sleeping and if I hear they're not pooping, those are the first two things I like to work on, sleeping and pooping. Because I find if you get the digestion right and you get people sleeping, oftentimes a lot of other issues will start to improve.
So basically your work is more of a pediatrician work. You try to keep them sleeping and pooping like babies. And hopefully, and actually babies don't have that kind of stress, right? And actually sleep has been shown to be sort of the reset for the brain, The brain actually is able to recover overnight with a good night's sleep to kind of resume its function when they're awakened. I think what you talked about, resilience, is so important. How do we assess this before we even start talking to them about sleep and digestion? What kind of questions you ask people to understand if they really are practicing their resilience skills or not?
Sure. Well, I certainly want to know the history, what's been going on, why they're coming in and how long this has been happening. And then I want to hear their schedule. I like to get good detail about a patient's schedule because if I don't really understand what their day is like, it's hard for me to understand how to even make recommendations. And then thirdly, I really like to get some good testing. And the testing is in different forms. It could be blood tests, it could be urine tests, sometimes different types of urine tests, depending on, what we talk about. And I want to understand a few things. I want to know what their nutrient levels are, how their thyroid's doing, what their hormone levels are, especially their stress hormones, what's going on with cortisol, which is an important stress hormone. And that tells me a lot specifically about the adrenal glands, because someone has very strong adrenal glands, you'll see their stress hormones are very, very high. So I know they have like a lot of capacity to handle it. In fact, they have too much capacity and they're kind of like a race car in the red, versus people whose resilience is very low and their adrenal glands are basically not putting out any more. And sometimes both of those people can have the same symptoms, And I do find when people have very low adrenal function and their cortisol is very low, they're also going to have a lot more inflammatory issues that could even show up on the skin, because cortisol, when you have a skin issue, right, what's the first thing a dermatologist will give you? A topical corticosteroid, and it makes it go away. So I want to study what is a person's natural corticosteroids doing, and that can help give me a clue on how to help them as well.
You just read my mind. I wanted to say we use, at least I myself try to use in the acute phase of any illness that I see, depending on severity, I use topical or systemic corticosteroids to kind of get the body back into shape to be able to even deal with the condition. And I wonder, do you find yourself having to do this in patients who are pretty severe?
Giving them topical corticosteroids?
Or even systemic?
I tell you, in very severe cases, sometimes we'll use something like a Cortef or some kind of corticosteroid.
Right.
But that's not very, very common. I mean, I prefer not to because unfortunately the corticosteroids don't allow the body to start making its own. So we really want to focus on, usually people have already had all those things. Look, if somebody's in kind of an urgent situation and they're so uncomfortable and they're so suffering, then of course, you need to use something. And that's the same with depression and anxiety. Sometimes you need to get people out of a jam, and that's where the drugs can come in handy. But the drugs are very heavy-handed, and they oftentimes make it a little harder to treat. Like, for example, when I see people with skin issues and they've been treated with corticosteroids over the years, I do find it takes longer to get them better because the body doesn't respond as much.
Yeah, and there is a feedback loop kind of going, especially systemically, when it comes to steroids in the body. So I wonder what kind of other interventions, you talked to us about how you assess and you want to look at their sleep and you want to understand their digestion. What are some common interventions that you have to help both restore their mental health balance, but also their skin balance, if you will?
Sure. Well, I certainly recommend some kind of psychotherapy and counseling work. There's no question that studies, like, for example, like people who have hair loss called alopecia, when they use things like hypnotherapy and cognitive behavioral therapy, you'll see not only improvements in anxiety and depression, but you'll even see improvements in hair growth. And that's even in people who have had complete scalp hair loss. So certainly getting the right cognitive therapy and talk therapy is going to be very important. I absolutely recommend physical activity appropriate to the person. Of course, some people need to do gentler. Some people do better with stronger physical activity. But that improves mood. It's shown to balance cortisol. It lowers inflammation in the body. So when people have skin and hair issues, those will improve with proper physical activity as well. And then diet. Diet's very, very important for everyone listening. If I don't know a person and they ask me to recommend a diet, I'd probably start with a version of the Mediterranean diet. The Mediterranean diet has been shown to be inversely correlated with things like depression and anxiety. So in other words, when you eat this kind of diet, you tend to have less depression and anxiety. And it has a very potent anti-inflammatory effect. And that's been shown to be very helpful in skin and hair issues as well.
Yeah, absolutely. And I think more and more people recognize not only the connection between the gut and the skin and the brain and the skin and the brain and the gut and the skin, but they also realize that if you can intervene, you can have a healthy diet, you can control the amount of fructose that we eat and all these other types of food. I think the next step that we will all face, all physicians, all doctors, all healthcare providers, is understanding how we prescribe these interventions in a way that's more personalized, when we can do full analysis, both of the gut and the brain and the skin, and try to really tailor these. Because I think one of the things that pharmaceutical industry has done well is really boil it down to science. It's really clear. Now we can argue about where it's appropriate to use, where it's too much. Like we mentioned, we try to use those only in really for the severe patients. But in general, I think this will be our next step. Listen, Peter, thank you so much. Dr. Peter Bongiorno, a naturopath doctor, really focusing on mental health. You have definitely calmed everybody around us who was thinking about freaking out and about their skin or in general. You took us through a nice tour, and I can't believe we did in such a short time, but I really feel we hit all our bases and really make clear the connection between the brain and the skin and how we can evaluate this and also maybe make some suggestions for our patients. Thank you so much for your time and expertise, and stay sane.
What a pleasure. Thank you.
Thank you for tuning in to today's episode with Dr. Raja and Dr. Hadar. This podcast is brought to you by Learnskin, leaders in integrative dermatology education. Visit learnskin.com/podcast to explore our many programs, or subscribe to the podcast today and never miss an episode. Hey, have a great day and stay curious.